Like so many people who face a decision about placing a parent into residential aged care, for Litsa Beck it was a struggle. Key points: 5 families who have had loved ones at Bupa Aged Care Templestowe have spoken with the ABC. 5 families who have had loved ones at Bupa Aged Care Templestowe have spoken with the ABC. They have raised concerns about the standard of care and staffing levels in the facility. They have raised concerns about the standard of care and staffing levels in the facility. Bupa said COVID had created significant workforce challenges in the aged care sector. 7 years ago, her father George Police was living with dementia and could no longer look after himself. His family moved him into Bupa Aged Care Templestowe in Melbourne. I was expecting specialist dementia care. I was expecting a workforce that were highly trained, Ms. Beck said. That was my impression. That is not what I found as time went on. George, 87, is still a resident in the Memory Support Unit, or MSU, at the Bupa home. Litsa Beck's father George Police moved into Bupa Aged Care Templestowe 7 years ago. In recent years, even before COVID-19, Ms. Beck says care standards had fallen. There's most definitely been a decline in staffing levels, she said. I would say it's become more and more frequent where I've gone in and found soiled sheets. I would come in at lunchtime or in the afternoon, and his bed sheets were soiled. But that issue pales in comparison to what she alleges happened in December last year, after her father returned to the home after a stay in hospital. Litsa Beck found her dad's sheets and towels soiled many times during her visits. Visitors were barred from entering the home due to COVID-19. So Ms. Beck called to check he had returned safely. She called again the next day to follow up. It was late afternoon. I rang again, and the nurse on duty was telling me that they couldn't get him out of his hospital gear, she said. The nurse arranged for Ms. Beck to come into the home. When I came in, I found him in his chair, asleep with just his gown and no pants, and just the nappy that he had on from hospital, she said. Ms. Beck says she found her father asleep in the nappy from hospital, a day and a half after he had been back at the home. I was pretty distraught when I saw him like that. At that stage, her father had been back at the home for at least a day and a half. It was horrible. It was probably the worst moment I had, she said. The ABC asked Bupa about the incident, but a spokesperson said, in a statement, that they were unable to respond due to privacy laws. Families stepping in due to poor care. Litsa Beck is not alone in her concerns. In all, 5 families with direct experience of Bupa Aged Care Templestowe spoke with the ABC, including 3 women whose parents now reside in the Memory Support Unit. Do you know more about this story? Email specialist.tmab.net.au. Altogether, that's the families of 1/4 of the unit's current 12 residents. Sarah's mum has lived in the MSU at Bupa Templestowe for 7 years. The ABC has changed Sarah's name at her request. She says her family, particularly her father, are not the complaining type. That she's speaking out now is an indication of how seriously they view the decline in care. My mum would be today if family carers weren't going in to look after her, she said. Between them, she, her father and her brother make 2 visits a day. We feed her. We shower her. We change her, she said. Sarah said the difference in staffing was the most noticeable change since COVID-19 hit. She believes the dementia unit has become much more reliant on agency staff to fill shifts. They come into work for a shift or 2, a week here and there. They don't know the residents, she said. Sarah said her mother had been left on the toilet for up to an hour, and agency staff did not know how to properly operate a hoist to lift her out of bed. Bupa is one of the largest aged care providers in Australia. In a statement, Bupa acknowledged it has had to rely on agency staff. The COVID pandemic has created significant workforce challenges across aged care and the wider healthcare sector, and we have had to engage agency employees to cover unplanned absences, a spokesperson said. Bupa also said it prioritised the use of permanent staff in the memory support unit, and if agency employees are required, they are placed in other areas of the home. Families say nothing's changed after Royal Commission. The families who spoke to the ABC are adamant the staff are not to blame, saying they either do not have adequate training or there simply are not enough of them. Mara Pagato's mother Natalie last year, after more than 3.5 years in the Bupa Templestowe dementia unit. Mara Pagato and her mother Natalie pictured in 2020. She said her mother struggled with weight loss due to the poor food she was served, and she constantly worried about the cleanliness of her mother's room. 1 year on from the final report of the Aged Care Royal Commission, she's disappointed. "We've spent taxpayers' money, millions on this Royal Commission, and what's come out of it," she said. "I don't see anything. I see staff cuts. I see poor quality food. Poor quality care. Nothing's changed." Bupa has 59 aged care homes across Australia, making it one of the largest aged care providers in the country. Mara said her mother struggled with weight loss due to the poor food she was served. It has been the centre of allegations of poor care before. In 2019, the chief executive of Bupa for Australia and New Zealand, Hisham Elanzai, apologised after numerous failings were reported by the ABC's 730 program. The ABC revealed from 2018 to 2019, Bupa nursing homes was cited by the aged care regulator for failures including understaffing and physical and sexual assaults of residents. Accreditation reports analysed by the ABC during that period revealed 30% of Bupa's home were putting the health and safety of the elderly at serious risk. Bupa said in a statement, "We've made significant improvements in our homes since the period from July 2018 to May 2020, when we had 15 homes under sanction. Since May 2020, only one of our homes has been subject to sanction. Aged care homes sanctioned by the Aged Care Quality and Safety Commission regulator lose access to government funding and are unable to take new residents. Information about aged care facilities hard to navigate. But problems remain. 11 of Bupa's homes, about 1 in 5, currently have non-compliance orders issued by the ACQSC. Homes are able to operate with non-compliance orders, but they are meant to fix the problems raised by the ACQSC as soon as possible. Finding out the details of those orders is a cumbersome process. On the ACQSC website, due to the exceptional circumstances of COVID-19, the most recent compliance update for Bupa Templestowe is more than 2 years old. The last audit of the home is nearly 3 years old. Residents and families can also check on a home's performance through the My Aged Care web portal. Navigating to Bupa Templestowe on that site reveals contradictory information. The home receives only a 2 out of 4 rating for service compliance, with the words "significant improvement needed." But the Quality tab and the home meets all requirements in all 8 categories. The site notes there is a current non-compliance order for Bupa Templestowe, but there are no plain language details about what it is regarding. Geriatric medical specialist and researcher Joe Ibrahim said publicly available information about aged care homes was not helpful for families trying to find places for their loved ones. "The information that's provided is, I think, both vague and not in a user-friendly approach," Professor Ibrahim said. "It doesn't provide the level of information or detail that you would want. It's hard to find. You've got to navigate through a number of portals and understand what you're looking for. This has to stop families feel speaking out the only way to spread awareness." 1 year after the Royal Commission, access to information for those considering aged care homes has not improved. "There's a real lack of transparency," Professor Ibrahim said. "You end up with legalese document S, which makes no sense to the partner of an 80-year-old with dementia trying to work out, is this place going to provide the care that's needed?" The families are speaking publicly to help spread awareness of the conditions in aged care homes such as Bupa Templestowe. In response to inquiries about efforts to improve transparency, the ACQSC said. The Australian government